Thanks so much for joining us, everybody. My name is Sean Wilkie. I'm the CEO of Talkatoo, the co-host of the Veterinary Innovation Podcast, and lucky to call this guy, Stephen Cital, a friend of mine. So Stephen, welcome, and thanks so much for joining us.
Thanks for having me.
So Stephen has got an incredible background, doing all kinds of interesting research at Stanford, opening a vet hospital, founder of one of the largest fake Facebook groups, Anaesthesia Nerds on Facebook, an unbelievable champion of the veterinary nurse and technician. I think I'm just trying to give you a little bit of trouble there, Stephen.
Poke the bear. Poke the bear.
Yeah, I know. I just can't help it. And we're super duper excited to have you here to talk to our audience today about this new world of animal pain management that you're kind of at the center of. I know that you're just about to open a new hospital in San Francisco, and that's going to be a big focus of what you guys are doing there. I've been lucky to call you a friend for many years now, and we really appreciate you making the time to talk to our audience. And I guess without further ado, Stephen Cital, it's over to you. Have fun, and I'll be here.
Thanks so much, Sean. And I think I want to start off with something that you mentioned, because you mentioned some of the research at Stanford. So I wanted to chime people into the research that I'm doing at Stanford. And I haven't really told a lot of people about this. I think it's pretty exciting. So it's not necessarily pain related. Well, I guess you could make that argument, but it's anesthesia related. So there's some really cool technology that's out there that has been around for human medicine for a while. And it's called PSI, which is Patient Status Index. And that's essentially measuring the level of consciousness of a patient under anesthesia to make sure that they are truly at a surgical plane of anesthesia. I think we've all heard those horror stories from human medicine where they've given a person a paralytic, but the person is awake during the procedure, but they can't move, they can't talk because they're intubated. So what we're doing, or what I'm trying to do, is I'm using this special machine that uses ECG, EEG, which are measuring brain waves, whether we're looking at beta, alpha, gamma, delta brain waves, to essentially see when that brain is actually asleep and actually at a level of consciousness or lack of consciousness, so where the patient is not necessarily feeling anything under anesthesia. We don't necessarily use that a lot in human medicine. It's becoming more popular. We don't necessarily use it in veterinary medicine, but it's becoming more popular in human medicine. The other thing that I'm using or kind of researching right now are these fingerprints, these pharmacological fingerprints that we see also created from the brainwave. So we take that same brainwave activity and it turns it into a spectrogram of all these pretty colors. And we're finding that each individual drug has its own kind of fingerprint in the brain. And I just think that's super interesting. So that's kind of the work I'm doing right now. I have some side projects having to do with cannabinoids, but I think you guys are all familiar with that. If not, Sean can fill you in some other time. All right, so this lecture, we're not actually going to have a PowerPoint at all, which I think is really fun. And I hope you guys will chime in with some questions, with some comments, what you guys are doing in practice. But I'm really going to be talking about the evolution of pain management within veterinary medicine. So let's start off with a definition of pain management, or what pain is in general. So we have the International Association for Pain Studies, and they have evolved, thankfully, on this definition of what pain is. So pain is a physical sensory output and input of a stimuli, whether that is from disease, whether that is from some sort of exogenous or environmental factor, that has some adaptive and some maladaptive properties. So when we say adaptive, that means that your body is responding in a way to get away from that pain, or that pain is used as a signal to help guide you through your life, whether we should be jumping or not jumping, whether we should get away from something that's stabbing us in the side or stay there. So it's this physical sensation. But where they've really evolved, and I think is really important, and something that I'm going to focus on a lot, is the emotional experience that comes along with pain. So in human medicine, I don't think that we have really shied away from the emotional experience that's associated with pain. But in veterinary medicine, it was only 40 years ago that we had practitioners say that animals don't feel pain, or that animals need to feel pain so that they are going to not bother their incision site, or they're not going to be as active anymore, and never really addressing the emotional component of pain on animals. So I'm really glad that we have now accepted in veterinary medicine, one, that animals are actually feeling pain, and two, that there is this emotional experience related to it. One of the other things that I really want us to be aware of as we have this conversation today are the pain pathways. And, we talk about the pain pathways, or we talk about pain pathophysiology, but we don't necessarily think about how we are going to be choosing those medications based on this particular pathway that we're trying to follow within the pain pathophysiology. So when we talk about the pain pathway, we have the initial insult, which is called transmission. So if you think of like a blood pressure transducer, that's what I always think of when I think of transducer. That is actually the signal that is initiating what's called transmission, which is sending that pain signal up through the nerve fiber, where we get to the spinal cord and the dorsal root ganglion, where you get modulation. So I think of modulation as something like the embassy that's translating this information from this country over here, so we can send it to a different country over here so it's comprehensible. So we have modulation in the spinal cord where that information is translated, and then we have projection up to the brain where we have perception, and we have the conscious perception of that stimuli happening. And what's kind of interesting is within milliseconds, we have this signal transmitted from the transmission site, or wherever the insult is, and then it goes up to the brain and we have a reaction. That's why we don't even think about, if we touch the stove and we move our hand automatically. I'm not touching the stove and being like, oh my gosh, I need to move my hand because my finger is turning into barbecue. But we have this other component to it of this conscious perception, this emotional toll that comes in a little bit after we get that signaling to the brain that's going to have that adaptive response, right? So we have this emotional component that comes in minutes to even hours after that pain signal has been sent to the brain. So my point is we need to start thinking about analgesics and what part of this pain pathophysiology track are we actually targeting? Are we going to use something like a local anesthetic, which is going to stop the transduction altogether, stop that signal from even going up the nerve to the spinal cord? Or are we going to be treating the brain where we have that conscious perception of that pain? Do we need to give analgesics like opioids that can definitely dampen some of the effect on the perception of pain, but also use stuff like antidepressant drugs? So if any of you have heard me lecture before, I am not a fan of tramadol in dogs whatsoever, but I do think there is a place for tramadol for this conscious perception of pain when we combine it with other good analgesics that are hitting these other targets outside of the brain. So I want us to start thinking about analgesics and what particular part of the pain pathway that we want to target, and not just give all the same kind of pain management drug that are maybe relying on the transduction part, the transmission part, or the modulation part, changing that information and how it's interpreted within the spinal cord. Now, the other kind of thing that we need to think about as well is, I have to check myself all the time, I'll be completely honest with you, is we need to understand that not every animal, just like every human, is experiencing pain the same way. So just because this protocol of an NSAID and acetaminophen post-TPLO works really, really well for this dog does not mean that same protocol is going to be working well for this other dog that's maybe the same size, same breed, same age, same everything. We need to understand and respect that the pain experience is very individualized, and we need to be prepared to help supplement that animal if it does look like they are having breakthrough pain, or if it does look like this typical protocol that we use is not working sufficiently. So we need to be cognizant of the pain experience. Now, How do we detect pain? That has also evolved quite a bit, which I am really excited about, because I remember when I was young and coming into the field, we used to rely on heart rate, respiratory rate, and pulses, right? Like those are the three things that we were paying attention to. If that animal is panting, oh, it must be pain. If that heart rate is high, oh, it must be pain. Well, we have grown so much since then, and we have all these super awesome validated pain scoring systems. There are a number of them out there. The unfortunate thing about a lot of these pain scoring systems is a lot of them are really kind of focused on acute pain, and we don't have as many good chronic pain, valid pain scoring systems out there. However, they do exist. So I'm thinking of things like COAST, which was put out by Elanco, which is really good for things like osteoarthritis pain. We have the Glasgow or Helsinki short forms. But we even have technology coming in now. I think Sean will appreciate this with the apps that Zoetis has helped found for the feline facial grimace scoring, validated pain scoring system. So we're not only just going by these behavioral cues and these physiological cues like blood pressure, like heart rate, respiratory rate, etc., but we're actually looking at facial cues of animals. And so far, when it comes to small animal practice, we do have feline facial grimace scoring systems. And what's cool about the app in particular is you can take a picture of your cat, whether it's painful or not, and you send it through the app, and that uses an algorithm. I don't know if it's AI. I'm sure there's some AI component to it that helps detect if that animal is, falling in one of these categories of pain for that particular species. So I'm really excited about this. I know that there's a lot of interest, and I know that there's some work being done on dog facial grimace scales, which is very exciting. We have facial grimace scales for rats, for mice, for rabbits, for sheep, for goats, and several other less common species that a lot of small animal practitioners are using, but I promise you the dog one is coming soon. So
so fascinating, Stephen.
Yeah.
What app is that they're using? Because I've read a lot and met the founder of Sylvester.ai. That's more of a a consumer facing app, but also really cool. Have you seen that one?
I haven't seen that one. So maybe after this, and we'll post a link to it, to the app in the app store. So it's Paulo Stegal's work, but super duper cool app available for pet owners. And I believe they have a Glasgow pain scale system through University of Edinburgh that is available also for those types of techie people. I'm more of a pen and paper person, but those apps are really cool. So in addition to these validated pain scoring systems, which I think we should really be introducing into our veterinary practice as really that fifth or sixth vital sign within your practice, but also teach pet owners how to use them as well, so that you have consistency of care with that particular animal. And of course, we need to be a little bit more empathetic and understanding that those pet owners know that animal better than you. So, our interpretations of pain in a particular animal is important, but the pet owner's interpretation of pain, if they are really engaged and kind of following these different metrics, is also going to be really important, which kind of leads me to my next talking point of there is more and more research coming out. I know Dr. Margaret Grew at NC State is doing this kind of work, and some other behaviorists out there looking at the disposition and personality of the pet to determine how painful or what kind of pain experience they might have. So I think with all of my veterinary colleagues, we joke about particular breeds like Huskies or Pugs or even Frenchies in a sense, that maybe we may consider them a little bit like pain weenies, like they're particularly sensitive and are like, you're just being dramatic. But there is some evidence to show that, breed and personality and disposition does play into that pain experience. So we shouldn't necessarily write it off as, oh, it's just a Husky, it's being loud, it's being dramatic, because their pain experience actually might be more intense than compared to something like a pit bull or a German Shepherd. Well, German Shepherd's not a good example because they can be a little bit sensitive compared to other breeds, but The behavior and the personality of these animals is something that we should be paying more attention to. I can't remember the authors for this particular study, but they were really recommending when you're doing that check-in history, you ask them, hey, how does your animal seem to respond to pain? Are they pretty sensitive? Can they tolerate pain? Because that should help also guide our multimodal pain management protocols that we're creating for each individualized animal. Now with that, and this kind of ties into that personality as well, is we need to start thinking about stress. And I know that there's this big push for the fear-free movement for low stress handling, which is fantastic. But what I don't necessarily see the tie-in all the time is how stress is actually affecting the pain experience. So obviously we don't want the animal to be stressed out because it's just not fun. But we know that in people, and we know that in lab animal species, and we're starting to see evidence come out in small animal species as well, that stress can seriously increase the pain experience for these animals. So whether that is increasing those circulating catecholamines that can also be sensitizing to nociceptors, whether that is really triggering their sympathetic nervous system to really kick into overdrive, and they are over metabolizing or metabolizing faster some of the analgesics that we are giving these animals. So really treating that stress and that anxiety is going to be really critical. And thankfully, some of the medications that we're using, things like gabapentin, kind of kill two birds with one stone. I will do a shout out that gabapentin is not good for acute pain, but for chronic pain states, this is something that we can definitely utilize, and it kind of kills two birds with one stone as far as decreasing the anxiety and stress of these animals, while also supplementing kind of the analgesic component as well. And in that same breath, I want us to start thinking about how important or how detrimental things like boredom can be when it comes to these patients in hospital, especially if they're going to be boarding with you or they're going to be hospitalized for multiple days. We are busy people. We're a very busy profession. We are a stress profession because we don't have enough bodies all the time to do all the things that we want to do. But boredom, sitting in that cage, not having human interaction or other animal interaction can actually increase pain states as well. So when you're bored, you get to sit there and think about the discomfort that you have, whether that's from a traumatic injury or that's from a surgical procedure that you just had. That boredom can exacerbate that pain state for that particular animal. So this is where I really like to encourage people to incorporate more enrichment, whether that is putting little iPads in their cage so that they can watch TV or other little animals. I know not all animals love TV. My dog certainly didn't. But those little tile speakers, you can play music, which is kind of soothing for some animals. I know Spotify, Pandora, and what's the other streaming thing? Oh, Apple streaming. They all have like cat and dog stations now to kind of break that boredom or add some sort of auditory enrichment for those patients. And then incorporate things like feeding as enrichment. So just don't throw that bowl in there anymore and expect the animal to eat it. Get those busy feeders. Get something that's going to make that animal have to work for that food a little bit. Again, patient depending, and case depending, so that they have some sort of environmental enrichment that is going to take their mind off of this pain experience that they may be going through. And remember, if they're not necessarily interested in eating, that kind of thing, pain might still got tied up on my words. Pain management might still need to be addressed in those particular animals if they are not necessarily eating or interested in the enrichment that you're providing for them. So let's see. And then when it comes to this environmental enrichment idea as well, I think we also need to start considering how our practices is functioning. So there's a lot of talk and there's a lot of practices that are kind of moving towards this open concept practice model where the owner is allowed to be in the back of the treatment area. Some practices even let them go into surgery. I'm not there yet. If that's for you, good for you. But this is really where we can actually utilize those pet owners as part of the nursing care team for that animal in hospital. So if the owner wants to come in and hang out with their animal and there's not a big reason for them to not be there, bring them on back, because they are actually taking that role of someone that you would typically be paying to give that environmental enrichment, that TLC component. And with that, there's this other term that I like to use. It's called social resilience. So social resilience we see in people and we see in animals. There's some really cool documentaries on this for wild animal species about how important it is for contact with other beings, whether that's the same species or not. And when you don't necessarily feel like you have someone there caring for you, someone there looking out for you, your pain scores increase and your healing times increase. So social resilience is something that we need to really start considering when it comes to the pain experience in particular, and a lot of other things, the disease process in general for our animal patients. So social resilience, getting that animal some TLC while it's in the hospital. Now with that, I want to touch on husbandry a little bit, because husbandry also plays a big factor into this environmental enrichment component, but also the social resilience component. So little things like making sure that we have the right food available for the animals so that they're not having to be picky and getting us frustrated, but also doing things like getting that animal outside for sun exposure. We are finding out more and more and more that sun exposure, limited, of course, is going to be really important. There's a bunch of receptors in our eyes that help us not only with our circadian rhythm, but also for even appetite, which I think is kind of interesting. And then we all see our animals go and lay and bask in the sun. Let them get out there and do that natural behavior again. And even if you're in hospital, we still do this in my practice, where we have hemilaminectomies or the animals aren't necessarily able to walk yet, but we take them out in a laundry basket, or we take them out in some sort of container where they're safe so that they can bathe in the sun and really enjoy their experience. And again, have that social resilience component, because you have the nursing staff along with them or the pet owner along with them. Now, when it comes to treatment options, our treatment options have really evolved. And, what's kind of sad, Sean, is there's a study in human medicine that was looking at how long it takes for a practitioner to accept a novel or new therapy once it's introduced into the market. And Sean, do you want to guess how long that is?
Oh my, we're slow to adopt, us humans. Maybe a year, two, a long time.
Multiply that by 17. So it's 17 years, which is terrifying.
Wow.
And that's why we see this perpetuation of these, some of these myths when it comes to medicine, whether it's pharmacological or, this perpetuation of animals don't feel pain. It takes 17 years when a new idea is brought in the literature to be fully accepted by most practitioners. So I'd really like to get away from that, because we have some really cool changing ideas on common analgesics that we use. So one of them, and I gave a lecture on this the other day, is non-steroidal anti-inflammatories. So, we are educated that non-steroidal anti-inflammatories need to be used at this dose. They need to be given consistently. We cannot use them in animals that potentially have renal disease. That is all not true anymore. There's this update on NSAID therapy called pulse therapy, where we are intermittently giving non-steroidal anti-inflammatories for certain chronic pain cases. We are using decreased dosages of NSAIDs for these particular animals that are maybe on these non-steroidal anti-inflammatories chronically, instead of, overstressing those kidneys. I know kidneys are a big concern when it comes to cats and older animals in general, but we can do pulse therapy and have the same efficacy, especially if we're using that in tandem with a validated pain scoring system. So when it comes to NSAIDs, please use them, but, change your thought process. Let's use lower doses. Let's use the lowest effective dose. Let's do pulse therapy. Maybe that animal doesn't need to be not every single day, or doesn't need it twice a day. Another drug that I think we're seeing some evolution with, which is awesome because I've been talking about this for a long time and really trying to get this narrative out there, but I'm seeing my colleagues push it out there now. And so I'm super excited. It's with buprenorphine. So buprenorphine is a agonist antagonist opioid drug that is really nice because it's one of those drugs that we don't necessarily have to be as worried about when it comes to drug diversion, whether that's with our own staff in the hospital or sending it home with clients, because buprenorphine, like methadone, is being used as a drug to help treat people that are addicted to opioids. So buprenorphine has some really cool properties and even has what's called equipotent dosing to full mu opioids. So we can use a high enough dose of buprenorphine that is going to be as analgesic as something like hydromorphone, which is really, really hard for people to kind of swallow because we're always taught like, oh, there's a ceiling effect at 0.02, 0.03 mg per kg. But now I don't even use a dose of 0.02 mg per kg anymore. And I feel bad for animals that are getting that dose or anything less because more and more studies, again, are showing that those doses are just kind of like spitting on them. They're not doing a ton. When we regularly use doses at 0.03 to 0.06 milligrams per kilogram to treat pain in animals. So we have this new evolution of these common drugs that we're using, which I think is really exciting. And one of my other favorite drugs that we're seeing this evolution with is ketamine. So ketamine is, an old school drug that we've used for decades and decades within veterinary medicine. Oftentimes as an anesthetic. We do cat-val, still love that combo. I know people were thinking, oh, that combo is so old school. I love it. Why not use it? But ketamine can also be used for things called pain vacations or even microdosing subcutaneously for chronic pain states. I know we have some studies that are coming out on the sub-Q use right now, but I will say anecdotally, even without those studies, I'm seeing some really positive effects of using a 0.5 milligram, 1 milligram per kilogram subcutaneously in these really painful animals with chronic pain conditions. I use it intraoperatively as well. If my animal seems light under anesthesia, I'm not turning up the gas anymore. What I'm doing is, again, giving a microdose, 0.25 to maybe 1 mg per kg of ketamine IV to that patient instead of turning up the gas, which is great because we always want to decrease the gas as much as possible. Now, I mentioned something called a pain vacation. So a pain vacation, again, these have been around for a long time. I remember originally hearing this from Nancy Shafran, who was part of the Zoetis pain police team back in the day. But not a lot of people adopted this concept of having these animals that are maybe in these acute pain states or severely chronic pain states and are really, really uncomfortable. And we kind of need to reset them. So what we can do is check in that patient, mix up a bag of, maybe you want to use an opioid. I tend not to, but you could do something like lidocaine, ketamine, fentanyl, or morphine, some sort of opioid in there. I do an intermittent dose of buprenorphine personally, maybe some dexmedetomidine, and we're going to initially sedate that animal and allow them to wake up while on the CRI of these other drugs. And that's really to decrease central sensitization. And hopefully reset them so that when they come out of this sedation and the kind of this loopiness from those drugs, they are reset and those hypersensitized nerve endings and central sensitization are really decreased and kind of back to normal level where we can have maybe less pharmaceutical drugs involved in the management of their chronic or acute pain states. Oh my gosh. Getting a dry throat. Hold on one second. All right.
More tea.
More tea. So, the other kind of cool thing as far as the drugs that are being introduced into veterinary medicine are some new kids on the block. So this one's not necessarily a drug. It's considered a medical device, which is kind of interesting because you do inject it intra-articularly, and it's called Synovitin. So Synovitin is this medical device that you inject into the articulating spaces in animals with severe arthritis. And what it is are these nanoparticles of 10 117M, which is a radioactive particle that when you inject it into these super inflamed joints that have severe arthritis, that are filled with these inflammatory macrophages and synovicytes and et cetera, those inflammatory compounds are eating those little tin molecules, and because they're radioactive, it's killing them. And then they kind of shed off of the little tin molecule, and then more of them eat that. So it's this constant cycle of these inflammatory cells eating these little micro radiated particles and killing them, which is great because it's obviously going to significantly decrease that sensitization of those joints. And what's particularly cool about that therapy is it lasts anywhere from like 6 months to 1 year. So that's significant. And we have seen animals where we can take them off of their non-steroidal anti-inflammatories or their other big collection of conventional pharmaceutical drugs to treat pain in that particular animal. Now, there's another drug that we're finally getting here in the United States. I'm a little bit jealous because our UK friends have had it for a bit, but the use of anti-NGF drugs. So these are things like Silencia and Librela. These are anti-NGF compounds, which are going to stop NGF, neurogrowth factor, from binding to these particular pain receptors, which get oversensitized, just like many of the things that we're talking about. So it binds to those receptors, so it stops that hypersensitization of those nerves, which I think is really exciting. And again, this is a therapy that we can do intermittently so that that animal is not necessarily having to take daily pharmaceutical drugs to manage pain in those animals. I was just at the pain forum that NC State puts on, I think it was in April, and there was some really interesting arthritis researchers there. And, I don't have experience with these anti-NGF drugs yet just because of availability. But I'm very, very excited to use them. But I want to put out a word of caution just from that forum that I went to, in that in humans, and you'll also see this on the drug label, in humans, when they mix these anti-NGF drugs with non-steroidal anti-inflammatories, it actually increased the degradation of the cartilage tissue that was left within that arthritic joint. However, we have not seen that in animals yet, and I'm hoping that we will not see that in animals. I'm hoping that's going to be one of those species difference that maintains. But I would just be cautious. But in the same breath, we also know that NSAIDs in general can hasten cartilage damage, even in these chronic pain states. But we also need to consider and weigh the risks and benefits. Do we want to keep this animal comfortable and have a good quality of life, or do we want to keep them super uncomfortable and just lay there in pain because we're concerned about increasing cartilage degradation with non-steroidal anti-inflammatories, or mixing the anti-NGF and NSAID together? So we want to continue with our conventional pharmaceutical drugs, but also I want us to think a little bit more holistically, and depending on your comfort level. I try to be a science-backed guy myself, and I am not shy about using plant-based medicines or supplements, but I want some data there. But we do have some good data for particular compounds that comes from plants. And Sean, can you guess what I'm alluding to?
Sounds like your favorite substance could be.
Yeah, so cannabinoid products. So things like CBD. CBD has gotten a lot of attention. I'm considered like a CBD guy or guru or whatever. But you know what? I'm kind of bored of CBD, Sean. And oh my God, I'm just saying this to the world here. I'm kind of bored of CBD because we have over 100 other phytocannabinoids in these plants that are just as beneficial or more beneficial, including the acidic forms of these compounds. So I'm thinking of things like CBDA, CBGA, even THCA. THCA will not get you high, I promise. But they're really, really good anti-inflammatories that we can use in combination with our typical conventional pharmaceutical drugs. So I want us to start thinking a little bit more integratively. You don't have to go down the whole holistic path and never use pharmaceutical drugs again, but I like to blend these things together. We also have good evidence for things like ashwagandha, moringa, kratom in animals, and even acupuncture. So I'm kind of torn on acupuncture, if I'm going to be completely honest. I understand the concept. I understand it's been around for a long time. I just don't love the data that's out there. But I did read an article that was making me a little bit more of a believer in that acupuncture actually stimulates the endocannabinoid system, which then made a lot more sense to me as far as its efficacy and utility. Oh, Nikki, I think I just answered your question. I saw your question on my thoughts of acupuncture. I have one more comment when it comes to acupuncture as well, is I am really a firm believer in electroacupuncture. You know, the dry needling by itself, it's about 50-50 for me, but when we do electroacupuncture, I feel like I've seen really, really good results in animals. And I've literally seen animals go from not walking to walking with regular electroacupuncture use. So I hope that answers your question there. And then, of course, part of this integrative concept as well is introducing or utilizing rehab services. This is a booming industry right now. There's not a ton of great research out there, but what I do think rehab does is not only increases circulation, can certainly release myofascial binding, which I didn't believe in until my VTS rehab friends actually did it on me. I was like, oh my gosh, okay, this works. But rehab is just a really good thing for the social resilience aspect or the environmental enrichment aspect that I talked about earlier. So even though we don't have these papers saying, oh my God, rehab is amazing and it's definitely analgesic all the time. I certainly think it does, but we just don't have that research. But I think bigger picture, again, it goes back to that environmental enrichment and social resilience portion of pain management in animals. And then again, I want us to think about things like exercise, which kind of mixes in with rehab, but maintaining that muscle is going to be super important for those weakened joints because we're not necessarily relying on that joint anymore for maintaining structure, gait, or posture in that animal. We're also relying on those muscles. So keeping those muscles strong and healthy is going to be important. I saw a question about TENS units, and 10 units are very effective while they are on the animal. So TENS units, if you're unfamiliar, they send a little electrical signal that interrupts nerve firing. And this is called gate control theory, where you, let's see, here's a pen. Here's a pen. So here's a pen. Here's an injury. There's a nerve that goes all the way up the limb. And say we put the little electrodes for the TENS units above that particular injury. So what we do in my practice is if we have an animal that has, a chronic wound or even a fracture and we're doing bandage changes, we'll put the TENS unit up here. The injury might be somewhere over here, but we can work with this particular limb that might be very painful. And historically, we had to sedate that animal or give it some sort of injectable analgesic. With the TENS units, we don't have to do that anymore, which is really, really cool. But again, TENS units are only working while they are on the animal, unless you get the NMES units, which actually cause a greater contraction of that muscle, which is good for maintaining and building muscle. Those effects can last a little bit longer, but again, they're relatively short-lived compared to other therapies. All right. Let's see. What else was I going to mention? So laser therapy. Laser therapy, I think, is nice as far as the environmental enrichment aspect, is nice as far as the social resilience and kind of bonding time you get with that particular animal. I will be honest with you and say that I do not strongly believe in laser for deeper tissue things. If you have superficial wounds, sure, absolutely. But when it comes to deeper wounds, when it comes to joints, I am not there. Again, at that pain forum, there's actually a DoD scientist studying photomodulation, laser therapy in people and in animals. And there is no good evidence. And they were very nice in saying that, the papers that we have in veterinary medicine are industry-led, and you will see that on every single laser paper, they are funded by a particular manufacturer. And the fact that the Department of Defense is actually funding this particular scientist to come up with a laser that actually does work for pain management and wound healing, et cetera, really speaks that there are no good quality lasers out there in the market right now. So sorry to burst anyone's bubble. Continue to use them, but try to do it ethically, please. Now, Sean, I think in one of the marketing pieces, we're supposed to talk about some of the certifications that are available for people that are super interested in the pain management side of things, right?
People like you. Yeah, it's unbelievable, Stephen, to just listen to you. It's been a while since I've attended one of your lectures, but I have before in the back room quietly. You're just so enthusiastic about this stuff, and I think that's why the rooms are always filled. But yeah, what are some things that people can chase down, or how can they enhance their skills, and what's out there for people that are as interested in this topic as you are?
Sure. So, if you are a technician, I'm a big technician advocate. I would really, really encourage you to look into the VTSs, or Veterinary Technician Specialty certification. So there is a particular academy focused in anesthesia and analgesia. So that is about a 3 to 4 year long process for those super ambitious credentialed veterinary technicians. And then the ALABTN, or the Lab Animal Academy, that I'm the executive director of, we have a subcategory in anesthesia, and it's essentially the same exact material that's on the regular anesthesia and analgesia certification, just in a lab animal setting. So those are two VTSs that people can pursue that are interested in pain management. And then obviously, if you're a doctor, you can do something like a anesthesia and analgesia residency. I know that is a lot to ask, just like the VTS is. So there is a certification called the Certified Veterinary Pain Practitioner certification, and that's through the International Veterinary Academy of Pain Management. And what's cool about that particular exam is it's very similar to the VTS process in that you need to submit some case logs. You need to submit some videos and pictures of the drugs and techniques that you're using. And then there is a big exam. But what's cool about that certification is doctors and veterinary technicians take the same exam. So I think as far as, what you can bring to a practice is, especially for a technician, is you're taking the same exam as a veterinarian would. And the way we utilize this in my particular practice is, the veterinarian goes in, does their physical exam, establishes that VCRP, and then you can have that CVPP go in and do a pain consult and say, hey, based on my expertise, I think this is what's going on and this animal can benefit from that. And then you and the doctor can collaborate together and come up with a good treatment plan. So really utilizing all of the team members, there's some growth opportunity there, but also providing better care for those animals with those certifications, because you are going to be considered an expert with the amount of studying and certainly the knowledge you need to know to pass that exam.
That's fascinating.
Yeah, and some other kind of cool things that have come out is NAVC does have the human animal bond certification. I think that's open to veterinary assistants and the whole team. I think even pet owners maybe even be able to take that particular course, but I think that's a really cool certification course that really focuses on the TLC component, the husbandry, and the social resilience aspect of what I talked about today. And then AHA just released their pain certification modules, which I think is really cool. And it's really focused for those general practitioners, whether it's a veterinarian or a veterinary technician or a veterinary assistant. You're getting a little bit higher level quality of information to make you kind of a leader in the field of veterinary pain management. So I think those are all really cool options that I encourage everyone to look into if they are interested in kind of pursuing this.
Stephen, the chat is blowing up because of the things that you have to say. Everybody wants the links to these, so we'll definitely follow up with those. Couple questions for you, and keep the questions coming. We've got lots of time left for Stephen to be here with us all. Can you get hours for the VTS at a general practice? Is the question.
Yeah, it depends on the specialty. So there is a clinical practice specialty, and that one's a tough one. It's about it's a 5-year requirement of experience, and you can get all of your experience at a general practitioner or at a general practice. Depending on your practice and what types of cases you can see, you may even qualify for the emergency critical care or the internal medicine as well. Or if you're a general practice that does a ton of dermatology, or if you have a veterinarian that's interested in dermatology or ophthalmology, or maybe you're working with a boarded dermatologist, ophthalmologist, general practices can certainly qualify you for those academies. When it comes to the anesthesia one specifically and working in general practice, it's a little bit more difficult because you do have to have anesthesia cases that are at a higher level of care. So those are typically 3, 4, and 5. And those are typically going to be seen in specialty hospitals or university settings.
That's awesome. Another question from the crew on the webinar here. How about pain management options for, I can't say the word because I don't know it, you can see it in the chat, in horses, aside from conventional methods currently used? I know you're not a horse guy, but what do you got for the audience?
So for horses, there is the VTS in equine medicine. And then for veterinarians under ABVP, there is a certification for horses in particular. But what I would encourage that person to do is join the AAEP, American Association of Equine Practitioners.
Yep.
They have, like, I joined because I was just curious because I don't really know anything about horses. I joined, and every Saturday they put out this wonderful newsletter. They send you this awesome magazine. Like, they have a lot of resources, which I would encourage whomever asked that question to look into.
And then another question back to the TENS unit. They were just saying, how do you use that on animals again in this particular instance? And it might be just helpful to cover that again if you could.
Yeah, absolutely. So for the TENS unit, I really like to use a TENS unit for like chronic wounds or post-surgical pain. So if I am needing to manipulate an animal post-operatively, whether they had a TPLO, a hemilaminectomy, anything that is cutting into soft tissue, I will try to place, and this is where you have to know your anatomy, certainly. I will place those little electro pads superiorly to wherever that wound is, or wherever those intervening nerves are going to be intervening with that particular trauma that is causing the pain. So let's see, where's my pen again? If we have an injury here, we know that the nerve path is coming down this way from the spinal cord. We want to place those units above where that wound is, or that surgical site is, so that we can stop the signaling or interfere that signaling. We can scramble that signal from that wound to the spinal cord. So we want to place it above wherever that wound is. And so, like, if you have an animal that's maybe a little bit aggressive, or maybe even though they have a good multimodal pain management protocol and they have really bad anticipatory pain, so like if you go towards the incision site or whatever, they're pretty reactive and they think you're going to do something to them. If we place the TENS unit near that or above that and we turn it on, if you need to do a lot of nursing care for that animal, take its temperature, check its urinary catheter, check its regular catheter, it'll offer you enough time and comfort for that animal so that they are distracted by that and not necessarily trying to be protective of their wound site. I also mentioned that we use it for bandage changes. This is maybe where I wish I had my PowerPoint, but I have this cool picture of this dog that had a really severe degloving injury of the foot. And we were sedating it every week to do these bandage changes because needed a lot of bandage changes, but we started using the TENS unit instead, and we could get away from necessarily sedating that animal, which just isn't fun for the animal, but is also quite costly to keep sedating that animal, and instead using a TENS unit.
And then one more question. Is there a certification, I'm guessing, related to pain management for hospice care?
Yeah, so don't quote me on this, but I believe NAVC also has a hospice or palliative care certification. But I also believe Lap of Love has some courses on that as well. I know there are at least 3 certifications out there, but I can't remember exactly who they are all by. But I would definitely look into Lap of Love and the NAVC certifications.
Great. Well, Stephen, listen, it's always a pleasure to chat with you, even if it's about a lot of stuff that I don't know quite a lot about. I've always learned something. Thanks so much for everybody that joined us. We're going to do a quick little demo of Talkatoo. Stephen, you can feel free to stay around or take off. It was lovely to have you. Thanks for answering everybody's questions. I'm going to show you quickly what Talkatoo is, and then you'll all be free to go just a couple minutes before we are meant to wrap up. Have a great rest of your week, Stephen, and thanks again.
Thanks, Sean. See you, everybody.
You're very welcome. So what is Talkatoo? Talkatoo is a very simple to use application that sponsored this webinar today. This is Talkatoo, little tiny desktop application that allows people to use their voice instead of typing with the keyboard. Simply pick up our microphone, press a shortcut on your, or press a button on the microphone and talk. So the end of painful medical records. And take a look, this is how it works. Rosie jumped out of a truck yesterday and her owner noticed that she was limping. Period, new paragraph. Thanks so much for attending our webinar. We really like to bring this type of educational content to all of the people in the profession. And it was a pleasure to have you here. New paragraph. Have a great day. And that's it, everybody. Thanks so much for attending. We will send the links to Stephen's certifications out in an email post the event. It was lovely to have you here. Bye-bye.